go ahead, have a seat. Make yourself comfortable. It's been a while. How are you doing? Okay, got a lot to catch up on, I'm assuming. Yeah. Just gonna jump right into it. Okay, yeah, go for it. Okay. Hold on. Wait, I did not know that that's what you meant. Where is this coming from? Okay. Well, I need to write this in pen. Okay, so back up for a second. So you were talking to friends and even some family members. Of course, my ink is gonna run out. Sorry. Okay. They okay. What exactly have they said? Because give me 2 seconds. I'm gonna pull up your chart here. How do you spell your last name again? Okay. I thought that we did that assessment. Did we not? Okay. Oh, I see anxiety, depression here. Not diagnosed, just that we went over it. So, let me ask you something. Are you trying to find something to, like, attach to? Is that some of the problem here? Like, do you feel like you need something to kind of, like, identify yourself with? No? Okay. Okay, so give me just a rundown of what they said. Okay. Well, that's just typical, behavior in that sense when you're talking to someone. I wouldn't necessarily just label that right off the bat as that. I don't even want to give it the name right now because, like, I have not personally seen any signs of that in you, but here's what I'm going to say. If this is something that you want me to assess, I will, okay? I will. However, I want you to understand that when we do things like this, we are not trying to attach ourselves to a diagnosis. Instead, we are trying to work on the traits of the diagnosis as a whole. Okay, so I do remember we tested you I thought we tested you for ADHD. Apparently we did not. So that one, sure, I will give you an assessment for that because it feels like everyone has some form of that one way or another. I am not a doctor that is going to give you medications. I am not a psychiatrist. I am not a therapist that is going to give you medications, okay? I am going to kind of just give you the rundown on the reality of it and what someone needs to do to manage it, okay? Medications are a last resort because it's poison. It's literally poison. It's so toxic. It's not good for your brain. It's not good for your body, okay? And a lot of it, too, is mindset, which we kind of deal with when it comes to CBT. CBT is cognitive behavioral therapy. It's all in the mind, right? However, if you really, truly feel like this is a major problem in your life, we will talk about that. But I've seen you for like 2 years now, almost 3, I feel like. I feel like it's been almost 3 years. Close to it. 2.5, whatever. I feel like I've seen you for a long time, okay? Now, I'm not saying I know it all, and I'm not saying that, like, I know you, because there's a very different version of you that I get when you're here and when you're out with your friends and family. So, today, I want to focus more on, you know, the steps that we're going to take to manage if ADHD is present. As far as the narcissism goes, I'll give you the assessment, but I don't know if I'm going to give you the results today. And we might not get through it today. We might not even get to it today, because I really want you to like take a step back and just reevaluate that one a little bit, because that word gets thrown around so much. Oh, they're a narcissist. They're a narcissist. When in actuality, people are kind of being conditioned to just have traits of narcissism, and it's just a societal thing at this point. It's like almost a trend to be so self-absorbed, right? But there's so much more to narcissism than people will say, you know, like there's so many things, because I personally know a narcissist, like a true narcissist, 2 of them. So I'm not saying nobody can have it. I'm just saying that, like, I just don't see it in you. You're just so sweet and caring, and I don't see you being manipulative or gaslighting anyone. But we'll see. We shall see. Okay, I'll stop talking and we'll get into the ADHD test. So you're just gonna have to let me know too if these things are present. Okay, so we're gonna go through the test on here, and then I will go through like the criterias on here, and you can tell me yes or no. Deal? Okay, so let's do this first. How often do you have difficulty concentrating on what people say to you, even when they are speaking to you directly? Never, rarely, sometimes, often, very often. How often do you leave your seat in meetings or other situations in which you are expected to remain seated? Okay. How often do you have difficulty unwinding and relaxing when you have time to yourself? See, again, I feel like that's an everybody thing, because society has made us believe that we have to go all the time, constantly. Because even I do that. When you're in a conversation, how often do you find yourself finishing the sentences of people you are talking to before they can finish it themselves? Okay, how often do you put things off until the last minute? I'm always like way ahead. I'm the opposite of that. How often do you depend on others to keep your life in order and attend to detail? Okay. What age group are you in? Let's see. I know these. What am I doing? All right. All right, well, okay. I'll tell you at the end. All right, so now I'm going to go over these. Now listen, symptoms and or behaviors that have persisted 6 months or longer in 2 settings: school, home, church. Symptoms have negatively impacted academic, social, or occupational functioning. In patients ages 17 years old, 6 or below, symptoms are necessary. In those age 17 or above, 5 symptoms or below are necessary, or above are necessary. So you need at least 6 and 5. I said that backwards, so it's 6 and above and 5 and above. Okay, or greater than 6. All right, so there's 4 different categories here, okay? And we are going to go over all of them. I'm going to go ahead and shut this off for now because it is making a very loud noise and we don't need it yet. Okay. So the first section that we're going to go over is inattentive type diagnosis criteria, right? So again, I'm going to list it off. You're going to say yes or no. Displays poor listening skills. Loses and or misplaces items needed to complete activities or tasks. sidetracked by external or unimportant stimuli. Forgets daily activities. Diminished attention span. Lacks ability to complete homework and or other assignments or to follow instructions. Okay. Avoids or is disciplined to begin homework or activities reoccurring. No, that doesn't apply to you. Okay. So now we're going to move on to hyperactive impulsivities. Squirms when seated or fidgets with hands and feet. Marked restlessness that is difficult to control. Okay, you seem pretty good right now. Like, you seem very good right now. Like, I think you're one of my favorites because you're so patient and you are pretty chill. Appears to be driven by a motor or is often on the go. Lacks ability to play and engage in leisure activities in a quiet manner. Again, you're very quiet when you're here. Again, though, like, you could be a completely different person outside of here, so that's something that we have to take into account. Incapable of staying seated, and that doesn't apply. Overly talkative. I think a lot of people are overly talkative these days. Okay, and then impulse interrupts or intrudes into conversations and activities of others. Okay, difficulty waiting turn. Impulsivity, blurts out answers before questions completed. No, you don't do that. Okay, now we're going to go to additional requirements. That one doesn't apply. Symptoms not better accounted for by a different psychiatric disorder. Do you have any other disorder? I know that... No, you don't. Symptoms not exclusively a manifestation of oppositional behavior. I can't talk today, can you tell? Let me say that again. Symptoms not exclusively a manifestation of oppositional behavior. No, okay. Classification. Okay. Yeah, so 1, 2, 3, 4, 5, 6, 7. So there's 7, but it's mostly okay. So a lot of it is just staying focused. Again, I really think that's a societal thing. I mean, think about it. We all watch shorts. We all are very quick with our attention span, right? If it doesn't catch our attention within 2 seconds, we're not interested. I'm calling all of us out right now, okay? Not just you, but everybody in the world right now. It's, if you can't get to the point in 2 seconds, I don't care anymore. That's a societal thing. So I personally don't think that you have ADHD. I think that we as a whole, as a society, need to learn to be bored. That's my honest view. That's my honest opinion. All right, let's turn this back on. Sorry, it's a little noisy. You know what, though? It's kind of relaxing. If I could type my password correctly. Okay, so do we have enough time? Yeah, I think so. Let's go ahead and do it. I am going to say that you do not have ADHD, which is a good thing. That's a good thing. But you may have traits of ADHD, and that's okay. It's just things to work on. Just making sure that you're paying attention and that you're staying focused and you're staying on track, all right? And, you know, I'll get to what helps with that in a little bit. I don't want to bombard you too much. You are very adamant about this test, so let's go ahead. It is online. Let me get to it really quick. Okay, there we go. So I'm going to turn this so I can kind of face you a little bit more. Move this out of the way. Okay, so I want you to tell me which one is you. I'm going to read 2 things. You're going to say this one, okay? I have a natural talent for influencing people. I am not good at influencing people. Modesty doesn't become me. I am essentially a modest person. I would do almost anything on a dare. I tend to be fairly cautious. I tend to be a fairly cautious person. When people compliment me, I sometimes get embarrassed. I know that I'm good because everybody keeps telling me so. The thought of ruling the world frightens the hell out of me. If I ruled the world, it would be a better place. Okay. I can usually talk my way out of anything. I try to accept the consequences of my behavior. I prefer to blend in with the crowd. I like to be the center of attention. I will be a success. I'm not too concerned about success. Okay. I am no better or worse than most people. I think I am a special person. I am not sure if I would make a good leader. I see myself as a good leader. Some of these too, like, don't be ashamed or anything about, okay? I just want to tell you that I need your honesty. I am assertive. I wish I were more assertive. I like to have authority over other people. I don't mind following orders. I find it easy to manipulate people. I don't like it when I find myself manipulating people. I insist upon getting the respect that is due to me. I usually get the respect that I deserve. I don't particularly like to show off my body. I like to show off my body. I can read people like a book. People are sometimes hard to understand. If I feel competent, I am willing to take responsibility for making decisions. I like to take responsibility for making decisions. Yeah, that one's kind of worded weird, huh? If I feel competent, I am willing to take responsibility for making decisions. Or I like to take responsibility for making decisions. So one is saying, if I feel that I can, I will. The other one is saying, oh, I'm going to make decisions regardless if I'm competent or not. Okay. I just want to be reasonably happy. I want to amount to something in the eyes of the world. My body is nothing special. I like to look at my body. I try not to be a show-off. I will usually show off if I get the chance. I always know what I am doing. Sometimes I am not sure what I am doing. I sometimes depend on people to get things done. I rarely depend on anyone else to get things done. Sometimes I tell good stories. Everybody likes to hear my stories. I expect a great deal from other people. I like to do things for other people. I will never be satisfied until I get all that I deserve. I take my satisfactions as they come. Compliments embarrass me. I like to be complimented. Okay. I have a strong will to power. Power for its own sake doesn't interest me. I don't care about new fads and fashions. I like to start new fads and fashions. I like to look at myself in the mirror. I am not particularly interested in looking at myself in the mirror. I really like to be the center of attention. It makes me uncomfortable to be the center of attention. I can live my life in any way I want. People can't always live their lives in terms of what they want. Being an authority doesn't mean that much to me. People always seem to recognize my authority. I would prefer to be a leader. It would make little difference to me whether I am a leader or not. I am going to be a great person. I hope I'm going to be successful. People sometimes believe what I tell them. I can make anybody believe anything I want them to. I am a born leader. Leadership is a quality that takes a long time to develop. I wish somebody would someday write my biography. I don't like people to pry in my life for any reason. I get upset when people don't notice how I look when I go out in public. I don't mind blending into the crowd when I go out in public. I am more capable than other people. There's a lot that I can learn from other people. I am much like everybody else. I am an extraordinary person. Okay, were your answers accurate and can they be used in our research? Okay, would you be willing to answer a few more questions for our research, 3 to 6 minutes before you view your results? We're going to say no to that. Okay, so it looks like, give me 2 seconds here. Okay, so I have good news. You are not a narcissist. You're actually a pretty incredible person. And some of the things that we talked about, they kind of go along with ADHD too. So the example of like, when you talk about yourself quite a bit. That's a very normal thing when it comes to having conversations, right? And sometimes all it takes is somebody to point it out and for us to go, oh, okay, I didn't realize I was doing that. Thanks for letting me know. And that's kind of what I'm seeing here. But if you have any other concerns, we can absolutely look into that. But again, a lot of it is the mindset that we are giving ourselves as well as what we're focusing on. So I'm going to tell you the truth. Nobody else wants to know the truth. A lot of people refuse it because that means that they actually have to accept it and then change. So the truth is, the only way you're going to be healed and free from anxiety, depression, and all of these nasty thoughts about yourself, I'm being so 1000% real with you, it's God. You have to lean on Jesus. You have to lean on God and His Word if you want to be healed from toxicity, if you want to be healed from these traits, because the world wants you to focus on yourself. And the more you focus on yourself, the more anxiety you're going to have, the more depression you're going to have. You're going to basically self-loathe, because the more you focus on the things, the more flaws you see. But if you're not focusing on yourself, and if you're focusing on God and the plans that He has for you, then you're going to flourish, you're going to blossom, and you're going to be at peace. So I highly encourage you just to take a step back and say thank you to the friends and family who brought this to your attention, and also give yourself grace. We're all human. We all have things we're working on and working through. But again, we are never going to fix those things. We're never going to be free from those things unless we give it to God. And I know a lot of people will argue that and say, oh, that's just a belief. Yeah. But it's also faith, because again, if you believe you have anxiety, you're probably going to have anxiety. But if you believe in God, and if you believe that He can heal you, and if you believe you don't have it, then you're probably not going to have it. So it just kind of goes into that sort of stuff. But ultimately, you don't have ADHD, you don't have narcissism. And a lot of it is just, again, looking at yourself and going, okay, are these things I need to work on, or are people just trying to pull me down? Something else to consider. Take everything that people say with a grain of salt, and that's why it's also important to just read the Word and focus on the truth, because this will not let you down. I mean, there's some crazy stuff in here, and you're going to be like, what? But it's not going to let you down. It's not going to pull you down. It's not going to make you feel like you're messing. Well, it will. It will make you convicted, which will make you feel like, oh, I'm really messing up here. But it's not going to make you feel depressed. If anything, it's going to bring light to your situation. It's going to give you answers, and it's going to explain a lot of things that you might need to know or need to hear, you know? So anyways, did you find this helpful at all today? That's fair. That's fair. So here, I'm not going to tell you what you want to hear. I'm going to tell you what you need to hear because I speak the truth. I am not going to base everything off of your emotions because sometimes your feelings aren't valid. That's the truth, right? But I am also going to take your emotions into consideration. I'm going to tell you that, like, yeah, you're allowed to feel how you feel, but does that mean you're right? No, absolutely not. I know, it's a hard pill to swallow, let me tell you, and that's why we don't do medications here. No, I'm kidding. Thought that was funny. No, but I appreciate you bringing these concerns to me, and one day I really truly hope that you look at these sessions as, you know, a way to see the truth and be grateful for them instead of like, oh, that's not what I wanted to hear. And I hope that you don't go home feeling like, oh man, that really ruined my day. Instead, I hope that you go home and go, wow, like I needed that today. Like, what are my next steps, you know? Like, I'm here to try and help you think and help you understand life a little bit more than what the world portrays it to be. Let's take a couple deep breaths. How's that? How's that, okay? Because I do care about you. I'm grateful that you're here, okay? I'm so proud of you for being here. And love and care is telling people what they don't want to hear, but what they need to hear. Exactly. Okay, so take deep breaths with me. Ready? Let's do another one. Very good. Okay. Well, I do hope to see you again because I think that we still have a lot to cover, a lot to go over because I see that you have a lot on your mind. So go home and process all of this and then call me and we'll schedule another appointment to see each other soon, okay? All right, you take care. God bless. I'll see you soon. All right, bye.